Very good evening, all of you. Nice to see all of you after a long time. I was just missing this. And welcome from SNIC Rehab Foundation and me, Harshali Kharche. I guess you all know SNIC by the time, but just want to just go over once again that SNIC is Special Needs Integration Center. We are based in Nagpur. So our basic focus is to empower parents. So we are working on the various areas like rehabilitation, empowerment, health, advocacy, and being. So here we are working on various areas like awareness program, parent empowerment, activities for special need children. That through Club Ananda, we are providing continuous sessions for the children. You can take advantage of the session. Those are all free for everyone that we are doing with association with Samarthya Foundation. We had done many financial advocacy webinars. Or we are supporting community health, mental health, physical health. So today we are here with Mr. Praveen Kumar, sir. I mean, he does not need any introduction. He is the founder of APH, that is Autism Parent Hub. So I will welcome him without wasting any time. I would like to welcome him for today's webinar. We are doing since long. He is helping out the parent in various areas. So today he'll talk about pooling resources for positive parenting. So welcome, sir, and over to you.
Hi, Harshali. You guys can hear me?
Yes, yes.
Okay. Thank you, Harshali. And I'm so happy that and so glad that we are associated with you. And you are the one who are helping both from APH or from the parents or from the therapists, that you became like a liaison and a bridge between the parents and professionals and a person like me who is living in a different country, and you will be helping us providing all the Zoom calls and everything. So thanks a lot. And dear parents, I think most of you know me, and people who don't know me, my name is Praveen. I live in US. I have two kids. My eldest son is having autism, and he's 17 years old right now. Like 10 years, 15 years back when I visited India, and I came to know that some parents are looking for help. And so my goal was to establish a happy place for all the families who has been impacted with a diagnosis of a term called as autism. So my goal is to provide all kinds of services, including like awareness, education, advocacy, workshops, and see if I can assist all the families who are really need help. So because I'm a parent like you, I understand the pain, the confusion, fear, anger, and all the other emotions that accompany and that comes with the autism diagnosis. But what my journey, when initially my son was diagnosed, so I came to know that how severe the autism may be, our children can do progress. So it is not like end of the life, or it is a karma and the sadness of life. So we can make the tears of sadness to tears of happiness. So but what exactly is going to work for children, our children? So when I saw the children from the age 2 to almost like recently, I have seen an young adult virtually who is like 55 years old. So after talking to all the parents, this was my conclusion, or maybe I can say that my research, that early detection, early intervention, and evidence-based therapies and positive approach which will lead to a good progress, because every kid is different, so every family is different. So if we can accommodate all the available resources in the less cost, less pain, and help the child starting from the day one, slowly starting from 1 minute, and then definitely it will have a big impact from the positive side. So but what we should do is, the parent should be the main teacher of the children. Rest of all our resources, like in case if you are going for a war, you will have all the resources to go for the war, but you have to do the war. Okay, so let us encourage and let us show the path that knowing, loving, working, and playing with the child makes all the difference in the happiness and well-being of the child. Okay, so that is our goal. Now Once we have the diagnosis, or after diagnosis, or after so many years, if you don't see any change in your child from the positive point of view, from a happiness point of view, how do you restart it? So we are going to discuss two things today: how to start, how to restart. Start means you are a young parent and you have a child like between 18 months to 3 years, and you just started this special journey because of a diagnosis called as autism. And you are a parent who has a child from between 4 to, I can say that 9, 10 preteens, and you have done a lot for your child in terms of therapies, in terms of school, in terms of family support, but you have not seen much progress as per your expectations, because the expectations versus results. If you have a high expectation and the results are low, then your stress levels will go up, and that will impact your health, and that will impact the whole family also. So my goal today is to bring all the resources back to into our pocket and restart the journey. Okay, start the journey. Yeah. So last time when I shared the presentation, it was so quick, and I could not give additional information regarding the presentation. So Harshali is going to share a PPT of like a couple of slides, so I can go through one by one very quickly, and then I will show you what we have in the autism parent subgroup. For example, I have posted, I have shared all the information from the last few years, but we get the questions, same repetitive questions. So I want to share like what we have in the group with in terms of pooling the resources, and then you can definitely go through one by one, and then you can come back to me, or you can go back to Harshali and like, I don't understand this. So then we'll call for a one more session. Okay. So let's, Harshali, please take over and share the presentation for me.
Yeah, it's shared. I've shared the presentation. Yeah, yeah.
Yeah. Okay. Can you go one by one, Harshali? So if anybody want to understand this logo, you see this, the parents are holding a baby with the diagnosis. So autism parents will come as an umbrella, so that we will provide you the support as a parent perspective. So we are here to support each other. So autism parents hub is like an umbrella. So let's go for the next slide. Next slide, Harshali.
Yes, can you see?
No, it's in the first slide only.
I have moved it.
Can you click on the second one?
Yeah, it's shared second only.
For me, it's showing the first slide only.
Can anybody confirm? Can you see first or second slide?
We are
able to see
the first one. We are able to see the first one. I think you have to enable editing to move to the next slide, Stephanie.
Okay, because I'm seeing the first, second. Okay, I'll just stop and I'll share it again.
Okay. Yeah, now we are able to see the second.
Okay, thank you so much.
Yeah, thank you, Ashali, and thank you, guys. Okay, if you look at this, the words here, parents, let us talk about a couple of things here. Once we have the diagnosis, because of so many reasons, like speech delay or hyperactiveness or social behavior issues, there are like so many things where we get confusion. And then we will check the developmental milestones, and then we'll go for diagnosis. And then after diagnosis, pain, frustration, agony, fear, and then we'll have a blame game in the family. Wife will blame husband, husband will blame wife, and both will blame the gadgets, they blame the TV, and they'll blame the relationship, so many things. And then some parents, they go into either depression or sadness, or maybe low in the family, and it will increase the stress. Finally, they'll do some research. So I don't know how many of you are confirmed, like, I don't want any more diagnosis, it's done. Because of some developmental delay, we have labeled child called as autism. So you started calling autistic child, and you started using the glasses, and you will never see your child as a child of like happiness or like a childhood, happy childhood. Everything your child do, you will relate to the autism. You will go into the groups. So you will go into the Google. You will go into YouTube. So for a couple of years or couple of months, starting from today, talk to yourself like from today onwards, it's my child. Diagnosis is just like a maybe a condition. It will go away, or it will be there, or it will be there for lifelong. We don't care. So just feel that I have a child who needs help and support. Doctors call that as an autism, but my job is to help my child from today, understanding his abilities, understanding his disabilities, understanding his likes, strengths, weaknesses. So once you have that mindset, you will be like, I should not go anywhere to look for a magic or a miracle or a medicine, because it is not a disease. It is just a condition. You might have read this or you might have heard this every day, but you have to make sure that this has nothing to do with anything. It is just a child who has a different wiring in the brain. I'm not a doctor, but I have seen my child from 15 years. If I try to tell him something, if he doesn't understand, that is not his problem, that is my problem. If he is going round and round in the room, it is not his problem, it is my problem. So every time I have to look at myself, what am I doing to my child? You don't need to do, you don't need to spend every minute to your child. Leave your child for a few minutes. You do your job and involve at the time when child needs your help. So you have to put your mindset like that. Don't look for like, I have this problem, my child is doing that, can I help? No, you have a lot of information in your brain which you have read in Google or read in books or heard from other parents. So just wipe off everything, clean your brain, give a hug to your child, and then start or restart your life from today. Okay, so we are here to discuss only the positivity. We are not here to discuss autism. We are here to discuss how we can handle the child every day to make the child independent. Some parents ask me like, sir, what happens if I die tomorrow? That is a very confusion question. Like if any parent will have the same problem. It's the same equivalent question is like, sir, what are the chances that I have an accident if I go on a highway drive? So it's the same thing. So don't worry about tomorrow, worry about today, what you have to do to your child. Okay, so from today onwards, no confusion, no worries about the diagnosis, and don't look for more doctors, more tests, and more research. All done. You have a child with autism. So that is from the left side. From the right side, you have a child who needs help and support in your family. That's it. Okay, the child came to your family for help and support. So always have that mindset clear. Okay, next slide. So as we talk about every day, we Google, talk about therapies, talk about services, talk about things in social media, WhatsApp. It will be too much overwhelming for you. Try to get out of all these things as much as you can, as much as you can, especially WhatsApp groups. A parent calls me, sir, the fellow parent's child got the speech. Why my child is not talking even though I'm not spending? So it's a comparison. So don't involve in too many WhatsApp groups. That is very, 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 what do you call, there will be an impact on your mental health. So, okay, social media means use it for fun. Don't use it for your child. Like to get like what I have to do to my child more. You are doing a lot to your child, and you are the best parent, and you don't need to look for a solution at this moment. If there is a solution for autism, which is a brain disorder, it will be a sensational news in every media, whatever it is. If there is a solution for autism, it will be a sensational news for 24 hours, starting from CNN to our local channels. They will run it, because autism is not in your family. It is in US, it is like 1 in 44 or 45 families. Okay, so it is going to be sensational. So don't look for a solution by yourself every day. Look for a solution for your child in terms of what kind of resources needed to help my child at this moment. whether it is a toy or a puzzle or an app or any kind of shortcut. So you have to look for those. Okay. And then next, awareness and acceptance. You have to keep talking to your family members to avoid the confusion. To talk to your neighbors to avoid the confusion, because everybody will jump in and give you the suggestions. Free suggestions is like always, people will give it to you for free all the time. Why don't you try that? Why don't you do this? Why don't you go for this treatment? The child in UK, he got recovered from autism. No, no, there is no a word called as recovery. It is always progress. Every child will progress if we provide the support to the child in terms of that child abilities, that child likes, that child strengths, that child weakness. Okay, so you have to provide the awareness and you have to accept it. Every day you have to accept it, because the child will go from today to the next 70 years and will have more challenges, and you have to overcome those challenges by acceptance. Okay. And the next one is, I always get questions like, so does this work? Does this syrup work? So does this tablet work? Medicines might work for some other conditions which are involved with autism, but not for autism. Okay. So there is no a quick pill or something like put it in the mouth and autism will go away. And so every medicine will have a side effect. So for example, one parent called me, sir, my son is dizzy, drowsy, he's getting obese, he's eating the food all day. And after 10 minutes of conversation, she says, sir, I started the medicine recently. So yeah, definitely, when you start a medicine, there will be a side effect, but you have to see why you are using that medicine. Does the medicine need, do you really need a medicine for your child? Sir, my child is hyperactive, I'm using this medicine. Nobody use a medicine for hyperactiveness. There are some alternatives, which I'm going to share how we can deal with the hyperactiveness. Okay. And then no, don't look for any magics and miracles. Once you look for magics and miracles, the exploitation will start. Somebody will say camel milk, somebody will say stem cell treatment, somebody will say HBOT. It is not all proven. It is not proven. Everybody is trying, but nobody is coming forward like me or like Harshali or like somebody else and say how it worked, whether it is a professional or a researcher or a parent. Where you started, what was the diagnosis, how is your child before and how is now, what are all the other things you did, have you done speech, occupational and other therapies along with this magics and miracles, or only the magics and miracles? So, and how is the child? Is he really having autism? Nobody knows. Some children will have misdiagnosis, some children will have overdiagnosis, or some children will have underdiagnosis. So it is a big puzzle. That is why wherever you go, search Google, the logo for autism is a puzzle. You cannot solve it. I will tell you in one line how to fix autism in children. There was a simple example. If you go to a page where you are looking for a spelling mistake in a word in a page, you can read the lines one by one and you can fix that. You can find the spelling mistake in that page. How much time it will take? Maybe 5 minutes. If I give you a book and the same word is in a page where is a spelling mistake, so you will read the book slowly 2 more times, 3 times, 4 times, and then you will find the spelling mistake. If I keep that book in a bookshelf which is like 100 books, how many days it will take for you to find the spelling mistake? It will take at least 3 months, 6 months, or maybe 1 year. And if you take that book and put it in a library which is having like a 10,000 books, how many days it will take to find that spelling mistake? If you take that book and put it in a millions of volumes of British Library, how many days it will take? It might take a couple of years, or you might use some device scanners and find the mistake. Okay, that is one child. If there is another child, there is a one more spelling mistake. So that is how the combination of the maybe chromosomes or genetics, I don't know, that is how that is the difficulty in fixing a problem in the brain. Because one of my friend who is a neurologist, he told me all these things. So that is not easy. It is connected with the DNA, genetics, and a lot of things nobody knows. So there's a lot of research going on. If they have something, definitely we all will know. But at this moment, we have to get the resources what we have, depending on your financial status, depending on your social status. You have to use those resources one by one, one by one, one by one, to make our child independent and functional. Okay, yeah, go to the next slide. This is what I tell every parent and tell to myself. Always, whether kid is having difficulty with autism, might be, but kid face more hard times or difficulties because of the parents who don't understand autism, because of the families who don't understand autism. Okay, and next one is early detection and early intervention will play a major role. If your child is diagnosed like 4 years back and your child is like 9 years now, what do you do? Sir, I want to start a good start again. Perfect. What you need to do is take a pen and a paper, do a self-assessment of your child for 7 days. If you are restarting your journey again, I'm not talking about the starting, restarting, and follow your child for 7 days. Don't force him, don't ask him, don't help him anything. Just see what he can do on his own. What are his abilities? Can he brush his teeth? Can he go to the bathroom on his own? What time he go to the bed? Can he do a puzzle? Can he do blow the balloon? Can he run? Can he walk? Can he jump? Can he sit and watch a TV? Can he go and get food from the refrigerator? Like, do a self-assessment and then come up with like, what are the areas your child is looking for help and support today? What are the areas your child is having trouble in understanding this environment? So write down all those things and then make a list of what you want to work on. You want to work on the sleep patterns first, so that the child will have better sleep and the family will have a better sleep and family have better time. And then once you have the good sleep patterns, then there will be no digestion problems, the potty will come on time, and the child will be very active, very focused, very good attention. So sleep patterns is good. And then you can start the toilet training. If the child is not toilet trained, there is no age limit for the toilet training. The only what we can do is we have to understand the child, like the patterns of the toilet. So once you know that, you can definitely help your child to get toilet trained. So sleep patterns and toilet train, and then slowly start like waking up on time, brushing the teeth, washing the face. So these are the things what every child needs. Okay, so when you are starting the journey, come up with an education plan, come up with an activity plan, come up with a functional skill plan, come up with a behavior modification plan. If you're restarting the journey, do the assessment of your child, understand what are the areas your child is looking for help today, whatever, no matter what the age is. Don't say that, sir, my child is already 10. What, 10, 12, or just the numbers. It is child I'm talking about. Don't look at the numbers. For example, my child is 17. Sometimes he get confused when he's in the bathroom, whether it is a cold water or a hot water. So I would go and help him. So you know where your child is looking for help. So that is the connection you need to have with the child. So those things will help in the long run. So that is why you need to have an education plan. Education plan is not like math, social science. Education plan is identifying, matching, sorting, okay, finger pointing, asking something, doing something, coloring, painting. All these things comes under education. So you can start with the scissors cutting, you can start with drawing a line, you can start with cutting a shape, and teaching the fruits, vegetables, vehicles, family member names, spellings, anything comes under education. So don't consider education is like social science, math, all those things. Education is, what I'm talking about, identifying the things in the environment. For example, I want an apple. If I don't know where the apple is, I don't know how I can express my word or my finger pointing towards the apple, then I have to teach my child. Okay, and then Don't worry about IQ scores, medical assessments, normal, abnormal. Don't say my child is abnormal, my other child is normal. No, there is no, these are all words used for no use. You will not get any help. Okay. And from today onwards, I will keep repeating this. Forget the questions like why autism to my child, can it be cured, do the diet work? I have no idea. Don't ask these questions to anybody, and don't ask the questions to yourself also. Okay. And then too much of autism education. Somebody will say, sir, I want to do a diploma. Sir, I want to do this course. Why? Do you want to become a professional? Do you want to help your child? What is the main goal for you to do a course? So you have to ask yourself. Okay. If you are just learning something for your child, means learn your child. Expert, become an expert of your child. You are a mom, become a girlfriend, become a sister, become a teacher, become a therapist, become a paraprofessional, become a social worker for your child. We don't need to worry about some parents when they see some little change in their child because of their some techniques, because of their effort, because of their knowledge, immediately they'll start a special school. Once they start the special school, they will understand that, oh my God, this is not working for other children. No, because it worked for your child. If something worked for my Pranav, I cannot come and say this will work for Pranav, for other children also, because every child is different, every family is different. So don't take extra stress, do not put extra pain, take extra pain to have more education. So only the diagnosis, because you should know what's going on with your child. That is why you went to the doctor. It's done. If you have a diabetes, do you go to the doctor every day? How to cure diabetes? No, you have diabetes. What should I do to control the diabetes? Diabetes won't go away. To control the diabetes, you will have a diet plan, have an exercise plan, you have a different lifestyle, and the food you eat, you'll take care. So all the same thing with autism also. It is a diagnosis. Then how do you handle it? You handle it with love, patience, affection, support, and take all the resources from the internet and start helping your child. Starting with 1 minute. If your child can look at you, or you look at your child, if there's an eye contact, there is a joint attention, good. That's leads to a good start. Okay. So do not get into an emotional trap, and do not get into the technical trap. And autism is not a static condition. Tomorrow it will be something different, next year something different. Child from 2 to 5 years, challenges are like this, and 5 to 9, challenges will be like this. 9 to 13, challenges will be like this. 13, 19, teen challenges. So every set of years, from one time to other time, there will be new challenges. But if you know what is your child, if you can define your child, if you become an expert of your child, you can overcome all these challenges. If you do not understand your child, if you do not provide a visual friendly, adaptive friendly, play friendly, sensory friendly environment in the house, you will talk about autism, you will talk about problems, you will talk about different words every day throughout your life. Throughout your life. Okay, so don't go for too much education. Next one, last one, awareness, tolerance, acceptance. And once you come up with like, yes sir, I'm ready. Yes Praveen, I'm ready. Praveen Bhaiya, I'm ready to work with my child. I have 5 minutes of time today. But how do you help your child? Child at home, the feeling is like, I am at my home, I need something. And how do your child experience autism? I told you several times, theater experience. You go into a movie theater, nobody is in the movie theater, and you are watching a movie which doesn't have the subtitles and you don't understand anything. How do you feel? You are alone in the theater. You feel anxious, you feel nervous, you feel little stressful, you feel confused. So all these things happen to your child every minute of his life. So if I'm you, I'm the one who want to help the child. I'll go into the theater, sit next to him, talk to him, involve him, help him, support him, give him a hug, give him something which he can feel happy, and all these things. So always feel that this is not autism. This is what inside the brain. 2 plus 2 is equal to 4. 2 plus 2 is equal to 4 is not for your child. You have to help him. 1 plus 1 plus 1 plus 1 is equal to 4. So you have to teach what is 1, you have to teach what is 4, and you have to teach what is plus. And you have to teach the same thing with the fruits, vegetables, like 2 carrots plus 1 carrot is equal to 3 carrots. They don't understand immediately. 2 apples plus 1 apple is equal to 3 apples. So you have to put the apples and you have to show them, like, see, we're just counting 1, 2, and 3. You have to involve. Don't tell him. You involve him. You show him. Show the video. Make sure that listen to the audio. Okay. So you have to find a way to help your child in an easy way for the brain. If you put too much pressure, blow up. Processing is not easy for them. So what else you can do with your child at home? Go to the next one. Get next slide, Harshali. These 3 things. Any family in this session today, talk to yourself. One question, honest question. How many of you have a visual friendly, play friendly, adaptive friendly environment in the house? One parent will say, sir, I started, but I don't have much time, sir. Sir, I have done little bit, but not too much. Sir, I have taken some pictures, but I have not pasted on the wall. No, you have to do it today. You have to do it today. When you are going into a movie theater, you need a chair, you need a screen, you need a speaker, you need a door, you need a light, you need an entry door, you need an exit door, you need a ticketing, you need someone to show your seat, and you have to understand the audio, you have to understand the visuals and everything. Same thing at your house. Visual friendly. Your child need to see what he is doing the next moment. I'm giving you one quick example here. You wake up in the morning. What do? Show a picture. We're going into the bathroom. You need to brush your teeth. One more picture. And then wash your face. Come. Take into the bathroom. See on the bathroom door. Daddy brushing the picture. Mommy brushing the teeth picture. Kid, the child brushing. All the pictures are on the bathroom door. So your child is like, oh, now just I'm going into the bathroom. And then you go, show the paste, show the brush, show the towel, show everything, showing the pictures on the wall. So your child knows what is next. So no anxiety, no curiosity. And then you have to keep talking. Once you brush your teeth, we're going to have breakfast. So you come to the breakfast, like a dining room or a kitchen. You show the pictures of all the breakfast items every day. Point, use the finger pointing. Today you're going to eat chapati, roti, sandwich, omelette. Show. Don't talk. Use your finger. Use the child's finger. After 3 months, okay, this is my schedule. I wake up in the morning. I go into the bathroom, brush my teeth. There is a toothpaste, and there is a toothbrush. And if I don't know how to brush, my mama will hold my hand, and she will brush for herself, and she will help brushing me too. And then I'll wash my face. I will dry my face. I comb my hair. See all the schedule one by one. Okay, picture. Next. What do you do after combing the hair? Put the lights off in the bathroom. Close the door. Let's go into the dining room. And then options. What breakfast do you want? Look, what breakfast do you want? Sit on your knees. Hold your child's finger. Do you want sandwich? Do you want omelette? Your child might not respond. But you know what is your child likes. That is what I said, likes and dislikes. Put your finger and your child's finger on a dislike thing first. Banana. Your child doesn't like banana. Then put your finger on that. Say, do you want it banana? No. Hold the chin like this. No. Do you want sandwich? If your child likes sandwich, then he will look at you and say yes. If the child is not coming to that place, sit there. Don't give the breakfast right away. At least take like 15 minutes of your time. Let the child come to you. The child might cry. The child might have a meltdown, tantrum, run away. No, wait. Wait until your child comes to you. I see some parents, they just run to the child. The child even won't express. The child won't even come and say, I want this. Feed like a robo. If the child comes, they'll give the food. If the child comes, they'll give the water. If the child comes, they'll make the child sleep. No, Try to show some kind of emotion from the body. Wait until your child comes to you. 15 minutes, starting from 1 minute to 15 minutes. Do not respond to the negative behaviors. Okay, so show and tell and give. Show, tell, give. Show, tell, give. Triangular, joint attention. So after 3 years, I'm not talking about 3 months. If you do this consistently, 3 years, the brain is programmed. I wake up in the morning, I go to the bathroom, I brush my teeth, I wash my face, I dry my face with a towel, I put the lights off in the bathroom, close the door, go to the dining room. Mama will have all the breakfast items on the wall. I know the pictures. I know what I want. If I put a finger on the chapati, she'll make chapati. If I put a finger on the omelette, she'll make omelette. And then I go sit on the dining table. I will take a plate. I'll use my hands. I'll use my spoon. I'll use my fork. I'll eat the food. I will take the plate, go to the sink, put it in the sink and clean it and wash my hands and do what next? Because you already programmed your daily routine for your child. For example, you see Pranav, he goes to a special school, but he has a routine in the morning. I'll be in the meeting. He's 17 now, but at the age of 4, he's not like this today. At the age of 4, I have to go or my wife has to go with him. Like whatever I'm talking about, our bathroom is full of pictures. Wherever he see, he'll see the pictures in the bathroom. And then he comes to the dining room. We will sit on our knees. So we did all this. So now he's 17. He will go into the bathroom. He brushes his teeth. He washes his face. He will be ready. He will change his dress. He'll come into the dining room. He will take all his, whether he wants cereal, he wants omelette, he will do everything. But it took from the day of diagnosis till today. He's 17, but 15 years of effort by my child, not by me or not by my wife. It is effort of my child. He cried. He was crying, rolling on the floor. He jumped. He banged. He has done everything to take control of my life into his hands. But I was like, no, this is not today. This is after 17 years, how my child is going to be. I don't want my child to wear a diaper or to go potty in his dress. If there are some conditions which you cannot control, you cannot do like so much for your child. I know that. But if you know your child better, we can try something. I'm not asking you to show the world with my eyes or whatever I speak, but we can do something. There is something, the word something. Okay, so the positive side. That is what I was talking about, visual friendly environment. If you want more information on visual friendly environment, you go into Autism Parent Subgroup and you can see some videos which are linked to the SNIC Rehab Foundation. They have recorded my videos and they have uploaded also in their YouTube channel. Go and you will definitely understand what I'm talking about. And then start the visual friendly environment. Take 2 days off from work, or you pick 2 weekend or 1 weekend, Saturday and Sunday. Make a list of things what you want to do at home, what I explained, and then put all the pictures on the wall, put the posters, and then start a visual schedule. And then 3 months, 6 months, 9 months, 12 months, 18 months, 2 years, 3 years. Look back, you will be very happy. Your child will be very happy. Okay, so you fix your mind. Do you want me to handle this today and make a better life after 10 years? Or do I want to continue the same challenges, same problems for the next 10 years? Okay, sleep patterns. You have to do it today. Your child has to go to bed at 8:30. If your child is not going to bed at 8:30, that means you are adding more challenges when the age grows. Don't see your child as a 5-year-old. See your child as a 15-year-old, 15-year-old, 20-year-old, 25-year-old. Okay, that is a long-term approach. I'm not talking about therapies here. I'm not talking about therapists, all those things. We are talking about parent, child, home, environment. Okay, and next one is play-friendly environment. Play-friendly environment is how to make your child engage or have fun, or you can play with, or he can do things on his own. He can sit at one place. He can have some fun, feel some happiness, use his fingers, use his body, anything which is related to the play. So by cheap toys. You don't need to buy like Amazon toys of like $1,000 or $2,000 today. Starting with balloons, bubbles, okay, small cardboard boxes, painting. So set up that environment. You start playing, your child will come. Wait. Waiting is very patience, consistency, patience. Okay. And then adaptive. Adaptive is you go to an airport, how you feel. You look at all the signs, and then you will follow the signs. Adaptive. You tell your family members, this is my boy, I am helping, and you have to go with his skills, with his needs, and we have to provide wherever he go, that should be an adaptive environment for him. You should give some priority to him. You should give some extra time, extra love, extra effort, extra like, don't push him, adopt him into your world, go into his world, understand him, and bring him into our world. Okay, so you can Google visual friendly environment for autism, play friendly for environment for autism, adaptive environment for autism, which is autism friendly. These three environments in your house, in your class, in your school will help your child. Okay, related to the sensories, related to the behaviors, related to the development, related to the daily life. It will help a lot, and it won't cost too much for you. It's just pictures. Take a phone, take a picture of every family member, put it on the wall. He might see today, tomorrow. Buy some mirrors, life-size mirrors, and put it like in every room, so that the child can see himself, and then he'll start imitating. Not today or tomorrow. Okay, no negative thinking, only positive side. Work only for 5 minutes today. Don't worry about tomorrow. If we wake up tomorrow, if we are all alive, we'll work again. So one day at a time. Okay. Yeah. Thank you, Harshali. Give me 1 minute break. I will show my screen what I can come up with all the resources. Okay.
Sure.
Yeah, I'll just have some water and you can take some questions also if any parent is looking for some serious concerns.
Yeah. Parents, if you have any questions, you can put it in the chat box. We'll take up whenever sir is back. It should be related to whatever we are discussing, not the individual questions, please. In the meanwhile, I'll just tell you that we have our YouTube channel and we have uploaded all sessions on the YouTube. So please go through each and every topic is almost covered there. And Praveen sir's all webinars, previous webinars, recordings are also available on YouTube. You can go with and listen to them again and again so that you can get the details of it properly.
Okay. Harshali?
Yes.
Let me share my screen now. And then
Yes.
okay. Can you guys see my screen?
Yes, yes.
Okay. So I'm going to show you something here. This is in our Autism Parents Hub group. So when you want to talk about play-friendly environment, you can just take this as a reference, like how to set up a play-friendly environment. So You can buy some cars, trucks, musical instruments, skateboard, trampoline. You can set up some water buckets in the bathroom. You can buy some balls, magnets, marbles, balloons, stickers, Play-Doh. You can buy some Lego toys, stacking cups. You know, the plastic cups what we use for the parties. You can buy those stacking cups and ask like, you can buy like 5 cups and ask them to stack, and you can paint on those cups. So these are all the examples what we have. It doesn't cost much. And every day you have to talk about, if you are going to a grocery store, take a video or take a picture, talk to your son, talk to your daughter. So you have to show all these things in terms of pictures or videos. Okay, keep showing the pictures of your family members, mom and dad, bathroom, kitchen, bedroom, because the visual environment is like, visual is always permanent. Words will go away, or the language will go away from the brain when they start learning new things, but the visual is like always the permanent. So keep this in mind. Use the finger pointing, use the joint attention, use the yes or no gestures, because that is a communication. Don't complain that my child is non-verbal. You are non-verbal when you go to a different country where you cannot speak that language, where you don't understand that language. You are non-verbal. But what is communication? Communication is like you are looking at someone and you can express through the gestures. Like, for example, you look at me. I don't understand Punjabi language, or I don't understand much Hindi. But how do I express my needs? If I come to your house, I want to eat. I want to drink water. I'm hungry. I want to sleep. I want to go to the bathroom. I want to go party. I'm not feeling well. I'm not feeling well. So use like yes, no. Do you want to eat apple? No. Do you want to eat banana? Yes. Do you like ice cream? Yes. So teach the gestures, yes or no, finger pointing. What do you want, Pranav? Do you want apple or ice cream? He might not show the finger, but hold his finger and put it on that ice cream thing. Do you want ice cream? Yes, because he likes ice cream. Do you want cake? Yes. Do you want banana? No. Practice this. After 3 months, see the response. They'll say yes, no. Once they know yes or no gesture, 50% of the communication problem is resolved. This is what I talk about every day to the parents. Non-verbal, verbal is language. We are talking about the communication here. How do dogs communicate with you? How do pets like a cow communicate with you? There is a gesture, there is some body language. So you need to understand your child's language, and your child need to understand your language, not in terms of the words or not terms of the language, in terms of emotion, in terms of gestures, in terms of expression of the body. Okay. So for example, a child is giggling a lot. Like a parent will come, sir, my son started laughing recently a lot. No, what happens? There's no problem with that. That is a communication. He might be having difficulty with his potty, or he might be tired, or he might be too much stressed and he want to go to sleep. There is something with that body response. If a child started crying, there is something, maybe a toothache, maybe some rash, some pain, some bruise. There is something with every response from the child. If you're an expert of your child, you don't need to worry about his communication. Okay, so think like that. And this is a small example of a play friendly environment. Look at the screen and see what else you can do. For example, there is something here called as haircut. If you take your child for a haircut to a salon, he gets scared. But what you're going to do, you're going to a salon, take a video, or you can copy a video from the YouTube, keep showing it to your child so that he will understand where he is going, what is going to happen there. Okay. So cut it as much as you can in small parts, small pieces, and small programs, and then introduce slowly one by one, one by one, one by one. Don't push too much and don't expect too much. Okay. And let me go to the next one. This is called as a list of items, what you can do to your child starting from today. You can take the help from the therapist, you can take the help from the teachers, or you can do these things on your own. This is going to be like a Bible or a Quran or a Bhagavad Gita for any parent who want to make their child functional. Functional means doing it by themselves. Okay, individual living, self-sufficient needs, taking care of them. Okay, so child should respond to name. If you want to work on this, go into YouTube, child responds to name autism, tips for child responding to name, research and see what it fits for your family and for your child. This is how you need to make a plan. So once child started responding to name, and once you have the child's finger pointing that are interested and needed, if he doesn't want that, he want to say no. If he needs it, yes, but finger pointing is the first milestone. Some developmental pediatricians say that when the child miss the first milestone of finger pointing, there the problem starts. And what we do is parents, they'll hold our hand, they will pull, and they will give it to them. So that's done. So your child is getting what he wants, and there is no communication at all. So if your child hold your hand, pull to the refrigerator or pull to somewhere, don't go, sit on your knees, look at your child, and then show the pictures what I'm talking about. Do you want to go out? Yes. Do you want to eat? Yes. Do you want to sleep? Yes. Wait. The child will cry. The child won't respond. The child won't look at you, but wait. Patience. Somebody will come, your family members come say, no, I'm handling my child right now. I'm teaching my child. I'm training my child. Hold on. Create some rules at home. Okay. If the child is crying means you cannot give everything what the child want. What do you do when the child is 15? At the age of 15, the child won't cry. You know what? He's going to show you what he is. He gets aggressive. He's going to break the things. He's going to hit you really bad because he's 15 and he's strong. That is the concern I have today with the parents. I spoke to parents. I have spoken to some parents in 2014. At the age, the child was like 4. Now it's almost 11. The child is 11. Those days the child was crying. Now the child is getting aggressive. So extra higher challenges, serious challenges. Okay, so start working on this. This is a list of things you need to work on. Okay, parents, child respond to you can read this. This is in the what do you call, what we have in the autism parent subgroup. And once Harshali record this video and post it, you can see this again. So this is your list. Sir, I don't know where to start. Sir, I have to restart. Sir, I'm doing this, I'm doing that. No, are you doing these things by yourself? Do this to your child, help at home for 3 years, not 1 day, 2 days. And stop using the words behavior, stimming, sensory, diet, food, constipation. All these things will fade away. Everything will fade away. You cannot put your child on diet for long. Once your child is 10, 12, 15, no control. Trust me, you'll have an extra pain. So don't mix all the other problems with your child's condition. Your child's condition is a child is looking for help and support to understand this environment with his brain, with his abilities, with his weakness, with his strengths. So you have to go into your child's body and help your child. Do not stop anything, because if you stop, the child will have one more extra challenge. For example, if child is flapping, let him flap. What happens if you flap? No, nothing happens. It's not going to be bad. If one child is doing the head like this, let him do. That is his way of expression. When these things will go away, all these things will go away once the child knows this environment. So the problem is not the child, the problem is the environment. So if you provide a visual friendly, play friendly, adaptive friendly environment, and you have a plan like this, then see what happens. Look at this list. Start with 20 days. Next 20 days, my child should respond to my name, to the name. Like, you know how many times we called Pranav when we were working on the first one? 300 times every day. We'll go behind him, say Pranav, and then we'll hug him and say Pranav. We kiss him and say Pranav, and like that. And we'll take him to the mirror and we'll hold him like, who is this? Pranav, 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 like that. Every day, hundreds of times. And then he understood that as like that is name. Oh, if Pranav is a word, everybody says, and I get the attention. That is how children understand the name. Okay, so make the list of things and see what your child can do, cannot do. Cannot do means these are the areas your child is looking for help. Your child is looking for support. Okay, once you have this ready for your child, at least 50%, then your child is ready to go to either special school or inclusive school or regular school. So when you talk about, sir, my child is going to school and there is so much problems, my child is running away in the class, hitting others, not listening, not focusing, teacher has having a problem, that is not your child. That is the classroom environment. That is the teacher problem. That is the classroom problem. That is the problem with other kids, sounds, visual, so much confusion. I have shown some videos, 2 videos in autism parents of like how our children feel those sounds, the emotions and everything. So this is how you can make your child ready for the school. Okay. Yeah, read this, and any questions, please send me a message in the messenger or post it in the group. I can definitely give you the answer. See this picture. How much money you can spend for this? Maybe I can say in dollars, I can say $100 or maybe 5,000 bucks, 5,000 rupees. Can you see this first picture? Have you ever tried this, blowing like 100 to 200 balloons in the room? Have any mom played like this? Like these cardboard boxes? These are the stacking cups, painting, jumping on the balls, jumping on the trampoline, play musical instruments. And your child doesn't have the sitting tolerance. See this swing. We can make this with the saris or any blankets also. Okay, so ideas depending on your financial and family situation. You can buy some mask, animal mask, which is very cheap. Put the mask on your face and wait, make those animal sounds. See if your child comes to you, how he responds. This is called as play friendly environment. So we need extra time, extra effort to get into your child's life. Okay, so this is called as play friendly environment. You don't need to spend much money. You can buy the things depending on your financial status. So I am not talking about rich people here. We're talking about the middle class families who has a child with autism. Okay, and see this eye contact thing. This is one of the primary concern we have. So you read this document. What you should do is, I'll tell you an example. You're giving ice cream to your child. Your child is a smaller child, like a 2 years or 3 years. Take an ice cream and then put it your ice cream here near to your face. Sit on your knees. Look at your child and wait until the child look at you to give an extra spoon of ice cream every time. So practice that. There are some tips written by one of the therapists. So you can try this. So joint attention, eye contact, sitting tolerance. These are the 3 areas you need to start working slowly, one by one, so that you can build a communication channel, or you can build a relationship with your child in terms of like, my mom listen to me, my dad understands me, my mom and dad knows how to help me, how to support me, how to guide me, how to train me, how to teach me. Then there will be a confidence in your child. That leads to happiness in your family. Wow, My child is responding. See the words I'm using here. I'm not too good in English, but I'm trying to express my emotion in terms of a language. I don't care about grammar. I don't care about the how I'm saying those words. My goal is to tell you how to help your child. In the same way, your goal is to help your child with the resources available for you. You don't need to dig for something. It is everywhere. Look for more eye contact ideas in YouTube. Don't force your child. Guide your child. Show your child. Demonstration. Okay. So you have this also in the group, eye contact. And I will go back to, there is a video. I just stopped here because you can see how to get into his world. You can imitate what your child is doing, and you can do the things that child likes. And by not doing the things that child does not like, for example, if you ask your child to come and do the math, and if he doesn't understand the math, there's no use. And then for that, you should actually know what your child likes. That means you should become an expert of your child. Okay, and work on it and prepare a fresh list by noticing your kid the whole day. That is called a self-assessment. So if you follow your child for 5 to 7 days and make list of things, what he's missing, what he's struggling, what he's having a problem with understanding or connection, and then work on each one by one, 20 days. And don't look this side that he's not doing this, or he's flopping his hands, he's running around, he's jumping, he's screaming. No. Okay. So now I am going to one more screen here. Okay. Okay, this is our group. And every time you want to post a question in the group, go into the search box and look for this eye contact. I want to know what other parents said about eye contact. You can see all posts in the group. See how many times I posted this message, eye contact. Because every time there will be a question about eye contact, but nobody tried to search. So we have information either copied from the Google or copied from the YouTube. We are putting those links so that it will be easy for you once you join the group. Anything, you tell me what you want me to search on, the information is there. Okay, so let me close this one here. Give me 1 second. See, there's a link, how to deal with a hyperactive child. Do you have the audio, Harshali?
No, sir. Actually, while sharing, you have to share the audio also.
Oh.
While screen sharing.
Yeah, I'll put this link in the whatever the chart or in the group message.
Yes.
Okay, so all the parents are much concerned about, for example, hyperactivity, sitting tolerance, eye contact, joint attention. So make a list of all the things what you are concerned about and research the information particular to that particular topic and take the needs or take the information, document it, and start working for your child couple of days. If it is not working, stop it evaluate why it is not working, and then look for a one more idea. Come to the group or go to any forum and ask the question, hey, I have done this, but it's not working. Is there any other idea which I can help my child? Okay. So that is how you need to plan your life for at least 3 years. At least 3 years. And then you can see this message. See if you can set up some place for your child so that he can play, he can learn, he can go around and around. And then buy the interactive books. And then this is what I talk about, take the pictures of everything and show. And this is called as 23 points I wrote about. So keep trying to implement these 23 points as much as you can. And these are the subjects you need to work on every day, at least for 1 minute. 1 minute. Like we have 20 categories here. So 20 minutes of your time. So you can say that out of 24 hours, going, taking off the sleep, taking off the toilet, taking off the bath time, taking off the school or anything related to, there will be 20 minutes of your time and your child's time in the 24 hours, which is called as active time. Find the time and make a list of these items, and then see if you can train, help, teach, and then you can slowly increase the time depending on his interests. Okay. Because this is all important for a motor planning, for gross motor, for communication, for social, for self-care, for oral motor, for visual motor. Okay. And this is what we talked about, what we need to buy. And then see if you can take your child to the places, social places, like a movie theater or a birthday party or a marriage. You don't need to put your child all the time there. Just go inside, stay for 1 minute and come out. So that you can increase the time one by one, minute by minute, hour by hour, slowly. Okay. And then do not wait for years or months. If your child is going for therapy, talk to the therapist. What is the short-term goal? What are you working on? What is the homework I have to do at home for my child? How do I coordinate with you? And what is the long-term goal you're working on? So if there is no results for the next 3 months, are we going to have a meeting? And can I watch the therapy session? I want to sit with my child. And if there is a rule that the parent should not come into the therapy room, but I want to watch the therapy session. So if you don't know what your therapist is doing, then you don't need to send your child for therapy. Okay. So this is not against to the therapist, but a parent's legal right, because you are paying the money and it's your child, and you have to see what is going on in the therapy session. And you have to take the homework from the therapist. If there is no result, stop and work, but you start working for your child so that you can guide the therapist. Like, see, this is what my son do. This is how my son learn. This is what my son interests are. Okay. So evaluate for every 1 month or 3 months, 6 months, and then communicate with your therapist, tell your concerns are, and do not try any exploiting treatments for your child. Always create rules at home. Rules at home means if you are helping your child and one of your family members comes in, whether it's mother-in-law, father-in-law, and then they'll say, oh, your child is crying, leave him alone. No, strict rules. Your child is your child. You are the one who has to rule this world. Take everything into your control, mother or father, whoever it is. Take the control. You have to lead. You are the leader. You are the manager of this concern. Okay. Talk to the teachers, therapists about your concern. Discuss the plan, what they're going to do, how many days they're going to provide the service. If they're giving occupational therapy, what exactly the therapy is. What are they doing in the class? Talk to the therapist every day. If they are not answering you, stop the therapy. You don't need to, because you are the one who is paying the money. Okay. And then the next one, I have listed some of the websites which can help you, and the best website for you to start with or to restart with. This is a game changer in my life for my son. because it was $170 for an occupational therapy, and the insurance will cover only for a few sessions, and we don't know what to do at home as a part of occupational therapy. So one of a famous occupational therapist sent this link to me to do things at home, and this is a game changer for my son. Start working on all these areas. You see on the left side navigation. So if you click on fine motor strength, there are the tips and ideas how to increase the fine motor strengths. Again, you don't need to worry about how much money you're going to pay or how much money you have to spend on the resources needed. So these things will help your child in handwriting, putting the buttons on, putting the zipper on, using the brush to brush the teeth, and using the spoon or fork, washing the hands, eye-hand coordination. Like this will help in playing the games, using the bat, using the ball, catching the ball, throwing the ball, handwriting, and then upper body strength. Upper body strength will help. See how the ideas are. Okay, so use this website, and you can click on this all these video links so that to know how to handle the child at home by yourself. And this is one important thing here: senses. Some people call it as a sensory diet. Sensory diet is nothing but explaining your child what are all the smells, what are all the textures, what are all the sounds, what are all he can see, what are all he can smell. How do you do that? So prepare the list of all things in terms of a sensory diet. Like prepare a list of foods which he has to taste it, like sour, sweet, salt, spicy, everything. And then all the sounds and all the smells: cinnamon smell, vanilla smell, coffee smell, so that the brain will understand, like, oh, there are so many things in this environment to smell, to taste, to touch. Okay. Yeah. And I know going like more than an hour, uh, we can have one more session like this, but before concluding and going to the question and answers, I will add like 10 points here. Okay, I made a list of things. uh, yeah, the list I showed you before, like what are all the things you have to work at home. Don't forget to work on the sensory thing. Don't forget to work on the sitting tolerance. Don't forget to work on the eye contact, and do not worry about the hyperactivity, and do not worry about all the things what your child will do. Work on things what you want to work on, because the more the progress, the more the positivity, the more the understanding, the things which you don't like, the negative behaviors or the responses from your son or daughter will go away, definitely go away. Okay. And provide the visual play and adaptive environment, and work on the joint attention, like communication, finger pointing, yes or no gestures, and keep showing the pictures and keep showing the videos. Play the music all day, because music will help the child. Do whatever you can at home to engage your child in a positive side. Okay, and do not respond to the negative behaviors. Okay, Harshali?
Yes, sir. So we'll go for the questions now.
Yeah, you can go, and don't forget this website, therapystreetforkids.com, and read everything on the left side, like self-help skills. And you can see how to put the coat on, how to put the buttons on, zipper on, how to put the socks, shoes, putting the shoelace, and so much of OT ideas here. Okay, using the scissors, using the clip. Let me go one by one more time. And this is a link you can see. how to teach an autistic child to sit in a chair. So I'm going to put this in the group today. There are so many ideas. Like if you have a child is having a sitting tolerance problem, there are some ideas given by the parents, like first exercise and see what chair works for you. And see, some parents tried these teddy bears, some blankets. See the gym ball here, the yoga ball or gym ball, and see if we can get some stimming toys so that you'll have something on his hand and sit. So try different ideas. Okay. There is nothing like child has to sit like this, crisscross the legs, sit on the chair. He can lie on the floor. He can have a blanket. He can lie on the bed. So the whatever the thing which works for your child should work for you. Okay. And if I go here, there is a link which you can see so many ideas like how to help your child at home. We have all the resources, parents. I'm telling you, we have everything in the group, maybe posted by other senior parents, other parents who really work on things at home, everything. You just go into the page, into the group, the way I showed you, like how to look for the resources and then search for it. And then some parents keep asking me some questions like why do kids avoid eye contact, why do they cover their eyes, face, ears with their hands? There is a reason for everything. Okay, so those things will go away, fade away slowly. And don't worry about the speech, because even my son, even though I have done everything to him, he has a very limited speech, but he has a communication. And since me and my wife are expert of my child, his younger child is also an expert. So we know how to tell the other people that what my child is. So that will reduce the stress. Okay. And you can see this post: visual friendly, sensory friendly, play friendly, adaptive environment. And that will reduce issues. So we have to be consistency, and your language and your rewards will play a key role. And this is my, I don't know whether you call this as a little harsh way of saying, but this is the message I felt one time, that parents do not provide the environment and expecting something from the children, and which the children cannot produce the positive results because of that environment. So I'll read this again. Until you provide visual friendly, play friendly, music, functional development plan, and adaptive environment in your house, things will be same today, tomorrow, and after 10 years with more challenges, parents, which I don't want to wish any parents face this. Okay. So treat me as your brother. Somebody calls me sir, but I don't like it. Call me brother or Anna or whatever you like. You say Praveen also. I don't care. You can call me with any name. But my goal is to make every special needs father and a mother and a family live happily for the rest of the life without uh, taking the pain of like oh, my child is having autism and my child is not doing this. Let us help our child. And there is so much of revolution in the healthcare and revolution in the technology. And I'm very positive person that definitely there will be a thing which will be a groundbreaking in the future for our children, either through a device or a tool or something which comes, because there's a lot of research going on. So we have to wait until something comes, but we have to be ready by making our child as much functional, as much independent, and as much happy and as much positive. Okay. So we all will go together, and I will be connected with you as much as I can. And let us make this journey a successful journey. And we are not going to die today and tomorrow. We will live longer, as because God has given us a responsibility. And go into the autism parents subgroup one more time and see if you are missing anything there when you are looking for some activities or some ideas. Like for example, I posted this a long time ago. I don't know how many parents went to this. See, this is posted by some parents, a play group. So how to play with your child. ideas. You don't need to rethink, reinvent. It is everything ready. You go and look for it in the group. Okay. See, we have like, oh, see, how many ideas? Start working with one, two. You will know where the issue is. Okay. And it is just go and search in the group. Okay. Yeah. Thank you, Ashali. Yeah. Sorry, I've taken extra time now. Okay.
No, it's perfectly fine. You want me to go to one by one question from chat box?
Yeah, sure.
Okay. So we'll take the first question: how to manage self-talking and excessive talking? Some sentence repeated, same sentence repeated.
Yeah, definitely. So, who is that parent?
Mr. Vipin Agrawal.
Vipin Agrawal, can I talk to you for 1 minute?
Yeah, now you can unmute, sir.
Yes, sir.
Vipin, the first positive thing is your child is talking, right? Yes or no?
Yes, right, sir, right.
Yes. So, do you know why he is self-talking?
Uh, Actually, he's talking whatever he listen. Maybe it is a
Yeah,
dialogue of the movie.
that means he is experimenting, he is exploring, he is processing, and he's trying to understand, or he's looking for somewhere like I like this topic, and I want to be involved in this. So there is a kind of a communication from your son. So what you need to do is find out all the interesting things he like. For example, first thing is don't go and stop him that this is self talk. That is all like, because you read something about autism, and you also do the same thing. Like when you go for a walk, you will sing a song, you will talk to yourself, you may be inside or outside. So that is not a problem at all. That is not something which you cannot fix, or you don't need to fix. But what you can do is find out what is the interesting topic, or a book, or a movie, and then sit next to him and watch that movie along with him.
Okay.
Once you watch that movie, ask him the questions like, what do you like in the movie? What is the interesting thing in the movie? Do you want to watch that movie again? So whatever the topic he's talking, you catch
Okay.
that topic and you involve in that. Wait until, it might take hours, it might take days also.
Okay.
So my understanding is, either these are the reasons. One is maybe he's exploring the language, or he is experimenting the language, or he is processing the language, or he might be interested in that language, or he might be needed some help in understanding that topic.
Not only the topic,
Yeah,
but whatever has been done with him. If he was playing in the park, someone
yeah,
says to him something,
yeah,
anything, he
yeah.
repeated that dialogue.
Okay. Yeah, that means he's
Uh,
processing that. He's not repeating it. He is processing that.
okay.
So it is
And
just like a rote method. He's taking inside and he's saying that back, because we always tell or teach our children from the day one of the diagnosis to imitate our words, to repeat our words. So it is not easy to go the repetition of the words, repetition of the sentence. Like for example, I told my son, Pranav, say apple, say apple. So he's repeating my words. I'll say, what is your name? So he's repeating, what is your name? Then I'll say, I will put a Pranav's picture and a Pranav's word here, and I'll say, and I'll make my wife sit next to him, and then I will distract. That's like, before the imitation, when we're doing the imitation, we'll say like, Pranav, what is this? Say, Nana, apple. That is imitation. So he'll say apple. Next one,
okay.
once he get the words and the language, I have to change my strategy. Like, what is your name? He will say, oh, what is your name? No. So there is a confusion. Now I'll ask my wife to sit next to him. What is your name? And then my wife says, read, Nana, your name is Pranav. Say Pranav. So what is your name? Pranav. What is your name? Pranav. What is mommy name? Mamata. What is dad's name? Praveen. So practice that. So imitation is one side of teaching him how to repeat the words or repeat the sounds, and then question and answers are different, conversation is different, initiating, sustaining the conversation is different. So as a father, you need to balance and you need to train him or teach him or distract him or to help him in such a way that you are not supposed to do the imitation of these words. So stand next to him, help him where where he should imitate, where he should answer, where he should initiate. Okay, Vipin?
Okay. Okay, sir. Okay.
Yeah, but for this, the best idea to me or to any parent is comprehension. Write 3 lines of or 2 lines or 1 line of stories like Vipin Agarwal is my father and we went to Walmart to buy 6 bananas. That is a story.
Okay.
Ask him to read that story and you read with him and then
Okay.
ask a question like, who is your father? And then he will process that. Okay.
Okay.
And then when he is processing it, don't wait. Put your finger on your name, that Vipin Agarwal, so that he will understand, his brain will understand that my dad is asking a question and he's showing the answer also. So he'll feel very happy.
Okay.
Okay, I'll repeat it. Vipin Agarwal is my father, and we went to Walmart to buy 6 bananas. That is a story. He will read it couple of times, and then now your comprehension questions. Who is your father? Vipin Agarwal. Where do they went? They went to Walmart. What do they buy? Bananas. What is the fruit here? Banana. What is the number here? 6. Who went to Walmart? Our family. See how many questions and how many answers in just 2 lines of a story.
Okay.
Yeah, practice that with hundreds of stories every day about a movie, about a book, about a store, about a product, anything. Like your wife is cooking chapatis, ask him the questions. What is mama making? Chapati. What is the shape of the chapati? Circle. Can you tell me one more thing which is a circle? Pizza. Can you tell me one more shape, one more thing which is a circle? Cake. So
Okay.
how do you bake the cake? So ask him
Mm.
like questions, answers, questions, answers. And then once you practice this, his brain will get programmed that, oh, this is a question, this is a sentence, this is an answer, and this is an imitation. Okay.
Okay.
Yeah. So self-talk is not a what do you call, negative or a bad or which you have to stop. Self-talk is a child is learning something new and he's repeating and he's not processing. There is so many reasons for that.
Okay.
But the positive side is your child is speaking.
Speaking, that's right.
Yeah. Okay.
Thank
Thank
you.
you, Vipin.
Thank you.
Yeah.
Thank you. Thank you.
Yeah, next question is from Tejaswini. How should we work on the name calling response?
So go into YouTube, Tejaswini, search for responding to name, autism, or help child to respond to name. You will see hundreds and hundreds of videos. Or what I did as a parent is, we have make a list of things uh, to initiate a kind of a happiness in my son. Like we'll go hug like Pranav, and then we'll hug him. Tickle Pranav, and then kiss like I'm kissing Pranav, Pranav, Pranav. So I use the word every time, like tapping him and say, Pranav, come here, Pranav, let's go, Pranav. See, I use that word Pranav like hundreds of times every day. So I will touch him and say, Pranav, who are you? And I'll say, Pranav. So Pranav, Pranav, Pranav. So show him in the like, go stand in front of the mirror. Who is this? Pranav, like that. Like you, and then I don't know how it works for every child, but once you know that this is how my child look at me, this is how my child respond to me. So keep using the same. Don't use like a one person will use a nickname and one person use a full name. No, consistent. Use the same name and come up with an idea by yourself that what your child likes. Like your child likes ice cream. Like Pranav, ice cream. Pranav, do you want ice cream? Pranav, let's eat ice cream. Pranav, let's eat cake. See the word. So he should get that in like 3 days or a 5 day or a 7 day time, that this is the word my mama, my daddy is making me responding to the kind of emotion. Okay. So there is a 2 videos which I already posted in the group. How to, like, let me show you. Let me say, put this link here. Yeah. Yeah. Go to the next question. Harshali, I will search for this and then I will post it.
Yes, okay, Praveen. Next question is from Priyanka Manna. How to promote speech?
Oh, so, okay. Speech won't come like a magic or like you cannot promote speech. First, you need to build the communication, as I said in the session. So first it is receptive language. Receptive language is like what your child knows, and then expressive language. So first is finger pointing. There is a joint attention, and let me share my screen. That's a good idea. Hold on.
Praveen, your video
Share.
is not very clear actually. I don't know what happened.
Okay, can Shali, can you see my screen?
Yes, yes, yes.
Okay, can you, uh, Priyanka? Priyanka, can I hear your voice?
Priyanka Manna, are you there? I think she's not there. You can unmute yourself. No, I guess,
Okay,
yeah.
okay, parents, anyone, if anybody is concerned about like how to promote speech and how to initiate and how what to do with the speech, this is what we need to do. Speech won't come like a magic for anyone, whether it is a neurotypical or a special child. So this is the roadmap I already posted here after talking to one of the speech pathologists. First is communication, finger pointing, yes or no gesture, sign. Like you see a 9 months baby, they can communicate with you if they want milk or they want to go, they want to go to daddy or mama, they'll finger point it. And then the improvement in the receptive language, like they can finger point what is apple, what is banana, and then they can match picture to picture, object to object, and then they can sort. If you ask a like a 13-month-old or 15-month-old baby to sort it out, to put bananas in toys in one box and apples in one box, like that, they'll do that. And then they have a joint attention, eye contact, and then you'll have oral motor movements or sounds. You'll say ah, ma, ba, da, all the sounds they can imitate, and you can practice that imitation. But some children, they cannot have all the sounds imitation, so you can start the sounds what they're already coming up with, and then you'll have an approximation of joining sounds like ah, pa, ah, ma, da, da, and then you'll have a clarity of sounds, imitation of words, and then the rest you show the picture and they will try to have an approximation of that word and response to the questions. Then what is your name, what is this, and then the familiar words will come, and then there will be a self-talk, and there will be echoing called as echolalia, and there will be now speech exploration, and they will experiment with all the sounds, and then they'll start learning the alphabets, colors, fruits, vegetables, food items, and then they'll start reading the words and then do the spellings, and then the language skills with a lot of help. So as what they define in autism is it affects either communication or social, or there are so many things. So if you worry about speech, first build the communication with them, and then talk to your speech pathologist, like what are the things they are working on to initiate or promote or develop the speech in the child. But these are the phases. So if your child doesn't have the finger pointing, no communication, no gestures, and no imitation of sounds, I don't think any speech that comes without these will have a meaning. Maybe they keep talking something without even knowing what they are talking. So for example, my son, he can finger point, he has a communication, he has yes or no gestures, he can imitate the sounds. But when it comes to the 2 word, 3 word sentences, he is having difficulty even though 17 years old. So I cannot push him because he already touched the ceiling of his communication. So I have to go with from 1 to 14, like 2 3 word sentences, like he will say, dad, I want to go out, and then but he cannot come and talk to me like initiating the conversation or speech. Okay, so first if you start working on these at least up to 6 before 6 or 7 years old, then it will be a little easy for the rest of the steps in terms of expression. So but remember, reception comes before expressive. So more reception, less expressive. Reception equal to expressive. So receptive skills are the key for any child. Okay, because through receptive, they can at least do something before they come up with the speech. Okay, yeah. Next question, Harshali.
Yes, in speech, Praveen, I feel the child should understand that if he says something, then only we will understand.
Yeah.
Like they should understand the need of the speech. That's what I can guess from my kid.
Yeah, that is what I said. Every kid is
Yes,
different.
yes, yeah,
You cannot come up with a solution for every child without doing any kind of assessment. So that is why it was clearly written as we need to understand the facts, we need to diagnose the problem and providing the right services to the child, evaluate the result in 3 to 4 months and learn the lessons and rewrite the goals and then re-evaluate for every 2 to 3 months. And you need to understand that speech will never come like a magic. So if you have a speech therapist working for your child, go and talk to the speech therapist and then see what they are doing, what goals they are working on to build the communication or to prompt the speech or to promote the speech or to encourage the speech.
yes.
Yeah. Next question, Harshali.
Next question from Jovita. My son is 11-year-old and he is very much destructive. He tears everything, photos also. He has spoiled all our walls and furniture. Yeah.
What is the mother's name?
Jovita.
Jovita. Jovita, can I talk to you?
Yes, sir. Actually, I'm
Okay.
Ranjana Bhasin. Jovita is my daughter. She has registered this phone under her name.
Could you please repeat your name?
Ranjana Bhasin.
Ranjana, how old is your child?
He will complete 12 in July 19.
12 years old.
Yeah, he understands everything. He has speech. He can speak everything. He express all his needs, pain, everything,
Okay.
anger. But he is very much destructive. In this picture and all, I tried a lot with him, but his nature is to tear. He tear the books now also. He will
Okay.
scribble on the book. He
So
has written.
okay, what like you give a book to him, and if
Yeah,
he's doing that without reading the book, what will be your response? Will you yell? Will you scream? Or like when he started doing that for the first time, what
yeah.
was your response?
Earlier, I used to. I tried to explain him that not to tear the book. Means, it's Saraswati Devi's gift. You should not tear it. I tried to convince him.
Have you ever tried to have a reinforcement like if you do this,
Yes,
you will get
yes,
this?
yes. That eatable things, lot many eatable things I tried. Chips and all I gave him.
So
But
have you showed that emotion in your face that if you do this, mama will be sad and such
actually,
kind of emotion?
emotions are not in his feelings. He is basically uh, lack of feelings. He doesn't have feeling. Even if I cry in front of him, it doesn't make any difference to him. He is very much practical. He understands his own needs. That's all.
Okay.
Yeah.
Yeah. Okay. Let me do one thing. Can you post this question in the group so that what I can do is because I cannot go and ask the same question in other groups. What I have to do is as a part of some of the ethical things. So I need to copy your question and post that in the other groups where the behavior therapists and like some professionals. So I will get an answer for you. And if they have any questions, I can come back to you and ask those. Is that okay?
Yeah, which this autism parents hub group I have to put my question.
Yes.
Okay, search,
Okay.
press search.
Yeah. I wanted to elaborate like what triggers him and how when it was started, what was your response, and all those things. So so that what I can do is I will ask the same question to any because this comes under behavior therapy, and
Yes,
we
yes.
need to
My
understand.
son
Yeah,
has lot many behavioral issues. He hits also.
yeah.
Then always is in the way of irritating, family members. He will irritate us.
No, no, no.
Also
That
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 we.
is not that is not the child problem. There is something happened uh, when it started, and it continued. There are so many reasons, madam, because a child will not do things just by his mind or by his body, by the environment. So
Mhm,
we as parents never look
mhm,
the environment. We always look at the child.
mhm,
So there is something happened at one point of time, and it triggered that there is an attention seeking behavior, or it triggered that he just don't like it, or there might be a reason without knowing the catalyst. Even you cannot
Yeah,
help
and
or I cannot help.
yeah, and his
Yeah.
behaviors are not consistent also. No? Means 15 days he will be very good. He will listen to you. He will do everything nicely.
Yeah, so
15 days.
that might be hormones, because he's in
Uh,
preteens, and hormone
yeah.
preteen puberty
Uh,
issues.
uh,
Like there are all linked: puberty, hormones, preteens,
uh,
and he's exploring, and he knows that he's very strong. He knows that he can dominate you, and he can control you. He's manipulative.
uh,
He's learning new things, and he is copying the things he's learned from the school or from the society or from the neighbor.
mhm.
So you need to
Okay.
have a BMP. BMP is a technical document called as behavior modification plan. So to
Okay.
have that behavior modification plan, a behavior therapist
Mhm,
has to evaluate or assess the things like
mhm,
at what age it started, what parents did, and what are all the alternative or accommodations provided to your son from the day when he started this behavior. So it is all interlinked. We both cannot sit
mhm.
and talk and decide what it can be done, because we need to what do you call, do some assessment. So I will send you a questionnaire.
Mhm. Okay.
You, if you answer all the questions by like with a, oh, what do you call, without hiding anything. For example,
Mhm,
I'll give you a clear example. One kid was physically, emotionally abused at the very young age,
mhm,
and now the child is very strong, and the child started
mhm,
paying back to their parents today.
mhm.
But those
Okay.
parents, they never said what exactly happened. So without knowing the diagnosis, or without knowing the assessment, or without knowing the background, nobody can give you any kind of suggestion or a recommendation.
Okay. Mhm.
Okay, yeah. So it is not your
Sir,
child, it is not your
excuse me,
child,
sir.
it. Yeah.
Sir, can I interrupt? Actually, so my son was also doing the same thing. He is just 6 years old, and he has the same problem before. Like he has tearing so many things and destructive all the things.
Yeah.
So if you permit, I will put some points.
Yeah,
Actually, so maybe
sure.
in my kid, it was like it's a sensory type of issue, maybe because when they tear, they will love that sound, the tearing sound, or else they will put the paper in front of their eyes and they will tear, so that it will divide in two parts, and they love that thing. So for that, what I have done with my kid, I gave him some papers like colorful papers that comes A4 size colorful papers, many colors. So I need to give him and tear it in small parts. Like
Mhm.
I made one apple and glue it, put some glue on it, and the tear paper he has to put on that. So it's a type of activity also, and his need also fulfill in that. And also before that, whatever if he is tearing something, he need to ask me like, "Mama, can I tear it? Is it important?" So every time he used to come to me and ask me like, "Mama, can I tear it? Is it important document?" So these things I have given. And one more thing, I gave him a me time. Like, this is your personal time. In that time, you can do whatever you want. So that time I gave some other papers like newspaper or some paper. So he used to cut it, and not randomly cut, like he can make some shape with he can make some activity like truck or something. So this will be like their need will be fulfilled and it's in a activity based. So after some days it will gone. My child doesn't have the problem right now, but he had it before. So
Yeah.
this is my experience.
Yeah, I understand. Thank you for sharing your experience. But here, in this case, we cannot just straight away tell to mom that this is linked to the sensory because the child is 12 years old.
Yes, sir. Yes, sir.
And we have to, like, that's what the screen I'm sharing here right now. If you can read that,
Yes, sir.
any bad behaviors is not, it should not be encouraged or it should not be ignored. So if you all the parents, like we have around 73 participants today here, my request is do not ignore any bad behaviors, and do not encourage the bad behaviors. So there is an article written by someone. I just copied and pasted in the group several times, which is like a pinching, hitting, kicking, slapping, or what the mom said, like he's having like negative behaviors. So we have to determine the cause of the child action. And if we don't know what is causing him to act out, and then we won't be able to effectively address the bad behavior. Without knowing what is happening, and there is no way we can tell. So as it might, as I said, like you said sensory, I said puberty, is inability to communicate, but here the parent said he can communicate also. So it needs to be evaluated by behavior analysts. And what I can do is, once the mother can go ahead and post that in the group, I will come up with a questionnaire. What is triggering the child action, and when it started, and how it started, how you responded, what is his daily living style, what is his sleeping patterns, and have you trained him how to take care of his genital parts, and how he clean his penis. So there are so many questions comes up to provide a supportive environment, which is what we call as adaptive environment to that child, to control these behaviors in the future. Okay. Yeah. Go. Let's go to the next question, Ashali. I'll wait for that post in the group, and I will follow up. And please do contact me in the messenger in the coming days to have more discussion on this. And as a co-parent, I will definitely help you, because it is very common in the preteens and teenagers, but that is not acceptable. Yeah. Two more questions, Ashali. We have only 10 minutes time.
Okay, there are many questions, but okay, I'll go as they posted.
Yep.
It's by Suhani. My son is 20. Whenever I want to learn him, he always says soega or bahar ja.
Yeah, he's a 20 years old.
Yes.
Okay. I don't know how to answer this question, because I really do good with the young children, or children who is very younger than my son, with my parent perspective experience. Ma'am, are you a parent of autism parent subgroup? And kindly post this question in the group, because there are some senior parents who has children around 20 and 30 years old. So they might be the best fit for answering these questions, because we can, if it is a 2-year or a 3-year or a 4-year-old, I have an answer for that, to distract and to tell some social stories, and to show some YouTube videos, and put some music, or involve him in the kitchen. If I'm you, what I'll do is I'll put some priorities as a list of things to be done at home before to go out. So taking of all the other personal things of your son, I want him and you do the cooking, cleaning, washing the dishes, anything a 20-year-old boy can do at home physically. So you can try that. And then once all those things done, then you can give him that reward as like, now you can do whatever you want. So like you do this, you get this. For a 20-year-old boy, if he can communicate and if he can, if he's gross motor, fine motor skills, you can set up a daily activities like play basketball for a few minutes, watch a movie for a few minutes, listen to music for a few minutes, do some artwork, do some paint work, do some chapatis with me and prepare the chapati dough, clean the dishes, clean the bathroom, fold the clothes, prepare the put the bed sheets properly. So make a list of like 20 to 25 items, and next once he's all done, then give him what he wants, so that his mind will get programmed like oh, I cannot keep on asking the same thing again and again. That is what I plan for my son, if he is asking me to do the same thing again and again. Okay, yeah, next Harshali.
Yeah, this question is from mom Minakshi. She's asking how much important is masturbating for my son of 19 years. How can I help him? Because very awkward when guests are there, and though I sound little odd, but sir, being mother, I want to get respect for him.
Yeah. So any child who has this like especially the priorities, what you need to do is you have to find out the time when he is getting that feeling. So for example, you take my son who is 17 right now. uh, Whenever I see his like body responses, like he might need some private time, I will send him into the bedroom. I'll close the door. I'll say, Pranav, lie down on your own and come out when you feel okay. So after 30 minutes, I'll go and knock the door and say, Pranav, do you want to come out and have a bath? So now what he's doing is, after doing that repetitively 20 to 30 times in a month, now he's just say, Dad, I want to go into the room. That means he needs the time, and he'll go into the bedroom and he'll close the door. He will come out and then he'll tell me, Dad, can I have the bath? So he will take his underpants off, and instead of putting in the hamper, he'll put it in the bathtub and he'll clean it and he'll come out. That means he's trying to tell me that this is my personal time, and I'll go into the room and I'll go into the bathroom and I will be doing this by myself. So, but some parents, if they stop him, or if they're like, why are you putting your hands there? Don't put the hands off. And even though if you have like other people as a guest, and if he's having some issues, kindly tell him like, hey, do you need some private time? Let's go into there. And then you tell your guests also, as a part of awareness, that we are working on his personal things. So kindly ignore him. Do not pay any attention to him. Just do whatever you want as if that you are not even noticing him, so that he won't get that attention seeking also. So you have to work on both sides, from your guests and from your side and from your child point of view. Okay, so it is applicable for both girls and boys, that they need that space, and it is our job to provide that space. Hope I answered your question. And if you are not if you want more information, then let's go for public opinion, and you can post that question in the group and see what other senior parents want to say. You might have more concrete, more positive answers than me.
So actually, we had two detailed sessions also on the sexuality and masturbation for both boys and girls and everything.
Yeah.
So you can go to our YouTube channel and you can watch there. The professionals also had a detailed discussion on these areas. Okay, so do you want to take more question, or
I think I am done.
wrap
Is
it?
there any serious question? Like any parent is looking for literally right now the help, then I'll take it.
Okay, I can see Amit hands raised up. Can we?
Yeah, Amit. Yeah, let's give chance to Amit. Amit, yeah, ask your question.
Yeah.
Hi, Pranav. My name is Amit, and are you able to hear me first?
No.
Not very clear, Amit.
Okay, give me a minute. Now I'm audible? Hello?
Yeah.
Yeah.
Am I audible now? Okay.
Yep. Yes, Amit.
Pranav, my question is that I just came to know my child is just 3 years old and he has diagnosed with autism. I just consulted a doctor. I am very new to
Yeah.
this word. I'm pretty much confused where to go, how to consult, how the things, because lots of confusion going everywhere. Something
Are
telling
you a
this.
member?
So
Are
it's
you a
like
member of autism? Are you a member of Autism Parents of Amit?
yes, I just came to know about my brother, and I
Okay.
just joined 2 days back. But how to initiate thing is the more important because I want to work on the pinpoint things.
Yeah,
So I
what you
need
need to
your
do is
guidance.
very, very
Yeah,
simple, Amit. I know you're a young
yeah,
parent, and as I told you, autism is just a diagnosis or a label want to give you by the doctor, because there are so many symptoms and so many conditions which are coming under one umbrella called as autism, and even God doesn't know, or I don't know that whether it is autism or not. So basically, you have a concern and you went to the doctor, and they have a tool, and because of the tool, they told you that your child has autism. But what you can do is you can jump onto things in a positive way and go into the group. I have featured some of the links that what is really important for an young parent to be
okay,
more active, and read this. This is the message. I know it is a very lengthy. I'm showing it to you on the screen.
okay,
Okay. And read this information, watch all the videos and the links. You will be in a place where you understands that, oh, I can deal with this very positively, and I can make my child independent, and I can make my family come out of the whatever this emotion of pain, agony, and frustration. Okay.
okay, okay. Sound good,
Yeah.
bro.
So it is not like like you and your family going away from this planet. It is just a hiccup or a roadblock, and
Yeah.
it's something your child needs some attention, some help and support. So basically, from your child's heart, I can say that a child is coming to you, uh, deciding that you are the best dad in the world. So if you close your eyes, and if you can find a better dad, more better than you for your son, no, it is you. So he has chosen you as a father who can support him for his needs, to help him to function and to communicate. You are the best parent. So basically, God has given you a responsibility in this life, and please support your child, and don't think about autism, think about your child, that he needs a real big support from you. So go give him a big hug and kiss, from your point of view and from our point of view, saying that thank you for choosing me as a dad for this life, and I will definitely help you, and we will all help you, Amit, and do not worry. Okay.
Okay, okay.
Yeah.
Thanks for the
Yeah.
motivational words, Pranav. I will
No,
keep in
no.
touch and
Yeah,
will
yeah,
try
yeah.
to.
Don't try any exploitative treatments, and
Yeah.
do not get into the trap of any time like emotion or technical or exploiters. Okay. Yeah.
Just one thing I want to just before finishing. Two
Yeah.
things I
Yeah.
recognize. He's just keep flapping his hand. Just
No, again,
keep.
see, no, Amit, I just told you that,
Yeah.
and the whole session is about let the child do whatever he wants.
Okay.
If it is
Okay.
not hurting him, if it is not hurting
Okay.
him, and if it is
Okay.
not hurting others,
Okay. Okay.
whatever he is doing today, Amit, is
Yeah.
because he is not connected to the environment. He's trying to understand the environment. For example, I told you, like, you go into a movie theater, you sit on the movie theater all alone. Whatever you do is autism.
Okay.
Okay. If I
Okay.
take you, Amit, and drop you in a place where you don't understand anything, what do? You'll just run around, you'll scream, because nobody listens to you, nobody understands you, nobody come and show you what, and nobody come and help you.
So you are saying, correct me if I'm wrong, instead of stopping him from maybe unusual activity, we try
He will
to.
stop,
Yeah.
everything on his own once
Okay.
he knows what is this environment, and who is this, what is daddy, what is mama, what is this food, and what should I do, and how to lead my life, all those things.
Just
Yeah.
stop.
But
We
yeah.
have to try to stop him for not.
No, don't stop anything.
just he's trying to hit his head on a wall, keep trying to hit his wall.
Don't pay the attention. That is what I'm telling, because he's unable to communicate with you.
Okay, got your point. Okay.
Yeah, you build communication with him.
Okay.
You become an expert of your child. When he, for example, if your child is hitting his head, is a 3-year-old onto the wall, he might be looking for attention. He likes that, like, oh, whenever he do that, you're paying attention to him.
Yes.
Or maybe he is trying to do that because he cannot communicate with you. So once you do apply that, you build communication with him, you provide the visual friendly environment for him, you provide the play friendly environment for him, you keep him busy and reduce his anxiety, reduce his nervousness, and be there for him. He will understand, like, oh, my dad is helping me. So all these things will help him, and all the negative behaviors will go away and the positive behaviors will come. Okay. Yeah.
Okay.
Yeah. Read all the documentation in the group, and then post your questions, prepare a plan, and come up with a strategy to how to help your child.
Okay. Thanks for your motivational words.
Yeah, no problem, Amit. Yep.
Thank you.
Okay.
Okay.
Yeah,
can we wrap up today's session?
Yes, Harshali. Thank you everybody, and wish you all the best if you are starting the journey, and wish you a very best if you are restarting the journey. And I know, I always write this point, having a child with autism myself, this is a road with uncertainty, no outcome, no assurances, but and there's no hope also, but we are all working to come up with all the success in our life, and we need support, we need encouragement, and we feel like there is someone who is helping and someone who can listen. So let us help each other and make this journey a happy journey for us. Thank you.
Thank you so much, Praveen, and thank you so much, parents, for being here. And sorry we could not take all the questions because of the lack of time. But many questions, answers are there in APH family group, and whatever you are lacking information. So we have webinars on our SNIC Rehab Foundation YouTube channel. So you can go over all these resources and educate yourself in a better way. So thank you so much, and good night and bye-bye.